Assalamualaikum everyone. My name is Rabia and welcome back to my channel Health Plan Pro. This channel is related to health planning, which you can do for yourself and for your family members as well. So today's topic is 6 tips to help you pick the right health insurance plans. In this video, I will tell you some of the tips that will help you to get any right insurance plan for yourself and for your family members. So, without any ado and without any time wasting, let's start the topic and let's move towards the video. If you are buying health insurance outside a job based plan, you are in luck this fall. After years of cutbacks and some say sabotage of the Affordable Care Act during the Trump administration, the Biden administration is pulling out the stops to help people find good health plans on healthcare right now. The open enrollment period starts this week. You will have more time to sign up, more free help choosing a plan, and a greater likelihood you will be eligible for subsidies to help keep down the cost of a health plan you buy via the ACA marketplace. So, still picking health insurance can be hard work. Even if you are choosing a plan through your employer, there are a lot of confusing terms, and the process forces you to think hard about your health and your finances. Plus, you have to navigate all of it on a deadline, often with only a few week period to explore your options and make decisions. Whether you are aging out of your parents' plan and picking one for the first time, or you are in a plan that no longer works for you and you are ready to switch things up, or you are insured and want to see if you have any workable options, there is good news. Asking yourself a few simple questions can help you zero in on the right plan from all those on the market. Here are some tips on where to look and how to get trustworthy advice and help if you need it. Tip number one, we have know where to go. So it's not always obvious where to look for health insurance. In this country, it is a truly wacky patchwork quilt of options, says Sabrina, who co-directs the Center on Health Insurance Reform. If you are 65 or older, you are eligible for Medicare. It's a federally run program. The government pays for much of your health care. You might also be eligible if you have certain disabilities for those already enrolled in Medicare or in a Medicare Advantage plan. The open enrollment period to switch up your supplemental health and prescription drug plans for 2022 runs through December 7 this year. For those under age 65, Colette says the vast majority of us get our coverage through our employer. The employer typically will cover between 70% and 90% of your premium cost, which is pretty nice. Check with your supervisor on your company's human resources department to find out what, if any, plans are available to you through your job. Then there is Medicaid, the health insurance program for people with low incomes that covers around 80 million people, nearly 1 in 4 Americans. It's funded by both the federal and state governments but run by each state, so whether you are eligible depends on where you live. For practically everyone else, the place to go is healthcare.government, where you can shop for insurance in the marketplaces created by the Affordable Care Act, also known as Obamacare. This is where you look for health insurance if you don't fit any of the categories we mentioned previously. Quality says if, for example, your employer does not offer you any coverage, you are not eligible for Medicare because you are not old enough and you are not poor enough for Medicaid, you can go to the marketplaces, apply for financial help depending on your income, and choose a plan there. Tip number two, we have overwhelmed by the options. To help you choose, think about what is predictable about your health. At the number three, we have learn what a few of those wonky health insurance term means. Tip number four, we have get trustworthy professional help for free. Tip number five, beware too good to be true plans sold online. Tip number 6 is know your deadlines. That is very much important to know your deadlines if you are getting any insurance plan or any health plan. So that's all for today's video and for today's topic.